Most back pain doesn't actually start in the back. In this video, I'm going to show you the 4 most common causes of lower back pain and, more importantly, how you can test for them at home. And if you missed the last one, back pain will often go on for years and eventually affect hips, knees and ankles. The first most common cause of back pain is the hips. The hips are a ball and socket joint and they're designed to rotate. And when they don't rotate as well as they should do, maybe from prolonged sitting or too much driving, the back tries to rotate for them. The problem is that the lower back isn't designed to rotate, so it gets stressed and painful very, very quickly. Here's a quick test you can try at home. Lie on your stomach and bend your knees to a 90-degree angle. From there, slowly drop your legs out to the side. We should be able to achieve at least 45 degrees internal rotation. And as you're doing this test, notice if there is any pain or stiffness in the hip, in the groin or in the lower back. Are they moving freely or do they feel restricted? Pain, stiffness or restriction when doing this test may suggest your hips are contributing to some of the lower back pain you're experiencing. The second most common cause of lower back pain is the hip flexors. When they're tight, they cause the pelvis to anteriorly tilt, making the lower back arch. And that position compresses the joints of the spine, making them rub together and become inflamed. Here's a simple test you can do at home. Sit on the edge of a bed or sturdy table, hug one knee to your chest and slowly lean back until you're lying down. Keeping the other leg hanging freely off the edge, look at the hanging leg. If your thigh stays up instead of dropping parallel to the bed, your hip flexors are tight. An extra check you can do is to bend the knee. If you can't bend the knee past 90 degrees, your quads are too tight also. The third most common cause of lower back pain is the feet, especially if you have flat feet. When your feet overpronate, they roll inwards, and that inward roll twists the entire lower leg inwards, which then tips the pelvis forwards. And just like before, a forward tilted pelvis squashes the joints that make up the lower back, and over time that creates pain, stiffness and inflammation. Here's a quick observation test you can do at home. Stand barefoot relaxed in a mirror. Look for ankles rolling inwards, heels tipping outwards or knees appearing to drop in. Another clue is to look for thick calluses or hard skin that are developing on the heels or the big toes. Both of these signs suggest your feet are overpronated and might be putting extra stress on your spine. The fourth most common cause of lower back pain is a leg length discrepancy. If you've got one leg that's slightly longer or shorter, every time you stand and walk, the pelvis will tilt or rotate, and this will keep your spine under constant stress, constant pressure, and keep you in this cycle of lower back pain. Here's a quick test you can do at home to check for a leg length discrepancy. Stand barefoot relaxed in a mirror. Look closely at your hip height and shoulder height. If one hip is sitting higher or one shoulder is sitting higher or dipping, it's a sign that you may have a leg length discrepancy that needs investigating further. So there you have it, the 4 most common causes of lower back pain that I see in clinic every single day. Each one comes with a check you can do at home, and if any of these checks are painful, restricted or uneven, it's worth investigating further with a healthcare professional. If you like this video, don't forget to hit like and drop a comment below. And if you want to see more content like this again in the future, don't forget to subscribe to the channel.